Good evening. Breast cancer awareness is an effort to raise awareness and reduce the stigma of breast cancer through education on symptoms and its treatment. We believe that greater knowledge will lead to earlier detection of breast cancer, which is associated with higher long-term survival rates. To know more on breast cancer, we have with us today Dr. Rathna Devi, oncologist at Apollo Cancer Center, Teynampet, Chennai. Good evening, doctor. What is breast cancer, doctor?
First of all, let me start off saying what is cancer. It is our own cells because of some wrong influence, abnormal proliferation of cells happens and it starts moving from one part of the body to the other part of the body, that we call it as metastasis. So when this cancer happens in the breast cell, we call it as breast cancer.
And what are the causes of breast cancer, doctor?
See, like when you have a oral cancer, we can say smoking is the cause, tobacco is the cause. Likewise, we can't pinpointedly say it is a habit-related cancer. It is, I can tell you, like there are high-risk patients. Who are the high-risk patients? The patients who have attained early menarche, that is the first start of periods when it happens at an early age, and a late cessation of periods, which we call it as menopause. That is early menarche and late menopause. Nulliparous women, the women who didn't have an opportunity to give birth or breastfeed, are called as nulliparous women. So those people also come under high risk. A family history, though it is not a very big risk factor, but about 10% of people with positive family history come under this risk group. Then there is a treatment called hormone replacement therapy, which is done for other conditions. Even those people who get hormone replacement therapy come under this group. First childbirth above the age of 31 also come under the high risk group. So these are the people commonly come under high risk group of developing a breast cancer.
And what is an inflammatory breast cancer, doctor?
Inflammatory breast cancer is straight away an aggressive form of cancer where the skin of the breast, the dermal lymphatics are affected. So it presents with signs of inflammation. It comes straight stage 4. It's a very aggressive form. How the patient presents is with signs of inflammation. As you all know, signs of inflammation will be pain, calor, rubor, dollop, tumor. This is what we usually say as a signs of inflammation. So the temperature over the breast will be high. There will be redness, swelling, and pain associated with this breast cancer. That is called as inflammatory breast cancer. It is not a very common type. It's a pretty rare type.
Hello, doctor. I'm a 26-year-old female from Chennai. I am a homemaker and I have a problem in my left breast nipple, which has a pus swelling. Is it
swelling?
Yes. Is this some kind of cancer or should I not be afraid of it? Kindly let me know.
Because you call it as a pus swelling, I don't know exactly what you mean by pus swelling. I assume you are seeing a pustule. There is an infection which is on your nipple. And was there any trauma associated just before this happened?
It doesn't mention anything.
Okay, you won't be able to answer. Okay, so if you are worried, I think you should come to one of your doctor, check it out what it is. Unlikely if it has been a short duration and if it is painful and if you're seeing on top of it, if you're seeing pus over it, most likely it could be an infected pathology.
Speaking of screening and getting screened from your doctor, when should one begin screening for breast cancer, doctor? What is the ideal age, or is there any particular stage at which women should start getting themselves screened?
I think this is one of the best questions. I would like to answer this question. Like to tell you, when I started my career, or when I started off my career as a postgraduate at MMC, my teacher, the first sentence she told me was, cancer is a disease of old age. Is that true now? No. With the last 20 years, the scenario is changing and changing. Now we are seeing both younger women are equally affected with the cancer breast. So ideally for cancer screening, There are two methods which we usually say. One is the self-breast examination. The other one is the X-ray mammogram, which all of you are quite aware of it. For a X-ray mammogram, the ideal age is supposed to be above the age of 40. Above the age of 40 will be for the X-ray mammogram. Let me tell a few words about this X-ray mammogram. X-ray mammogram is a simple tool with which we can identify tumors less than 1 centimeter of size. It's a pretty sensitive tool, about 85% sensitive and specific. There are much more inventions has happened beyond X-ray mammogram with the TOMO, with the MR mammogram. There are much more inventions have happened to check out on these tumors, but the commonest screening tool is the X-ray mammogram. And here it is a high milliampere and a low kilovoltage. Why I am specifically telling this? Because in a breast, you have glandular structure, fibrous structure, adipose structure. All these things will be distinctly seen with the X-ray mammogram. So one who's having even with an experienced finger, if you're not able to feel, but a mammogram can pick up less than even 1 centimeter. So that is a very good screening tool, which is usual recommended age is about the age of 40. But I want to specify on the self-breast examination. Self-breast examination is every woman does that after the after your periods. That is, if you are you should not examine your own breast during your periods time. It should be done after your periods. It should be repeated every month once. It can be either done in your bedroom or your bathroom, and you are doing this self-breast examination on yourself. There are enough and more pamphlets available. You will have to look into it, how to examine whether there is any discharge in the nipple, whether there is any palpable mass in the breast, and don't forget your armpit. You repeat your exercise with the right hand to your left breast and your left hand to your right breast. Always do it with your flat of your fingers. Never try to pull your breast, because a young breast will be more felt like a nodular. So because it's a glandular structure is more dense, and you may feel there is a lump. So always do with your flat of your finger, and this has to be starting from the age of 30, I would say, or even earlier if you are coming under the high risk group, even like 25, or if there is a family history of breast cancer in the family, a woman who has developed a breast cancer around the age of 27, 28, you start it even earlier. The basic message with a self-breast examination is you have to be aware of your breast, and even a small change in the breast you will be able to notice, and thereby you can come to the doctor immediately. So basically I would say screening is self-breast examination and the X-ray mammogram.
You mentioned earlier that the number of women who are getting themselves breast cancer screened, or even getting a breast cancer today, are much more increased in today's date. Why is it so, doctor?
Probably we can tell the screening has become much more popular. The awareness with so many media now, even through Facebook, we are doing awareness. So people are more and more aware. And if you see, the breast cancer affects more of the urban population, more of the educated class. That is why people are seeking the help of the doctor, I can say. Probably the incidence is also increasing, and probably lifestyle, stress, all these can be a factor, though I can't tell, yes, this is the factor, but all of this can contribute to say that why we are seeing more and more breast cancers nowadays. The estimated is 1 in 28 women are affected by breast cancer.
In India, doctor?
Yes.
Okay. Hello, doctor. I'm a 43-year-old female from Chennai. My mother-in-law had breast cancer at the age of 39 to 40 in one of her breasts. What are the risks of my daughter also getting it? When should I start looking out for symptoms or get her screened?
First and foremost, relax. Don't panic. Just because there is a blood relative who got a breast cancer, only 10% there is a possibility of your child getting it. So we have to be just aware. As I told you, since she comes into the high risk group, you have to be aware, teach her the self-breast examination. Probably your child can have her first childbirth before the age of 31. So that way you're bringing down the risk. Breastfeeding should be given importance, and we should educate our children and the future generation to breastfeed the child. It is good for you, it is good for the child. That can be done. Probably the self-breast examination should start much earlier for your child. And you can be in touch with your doctor to get more advice on this. Don't give any stress or don't create a fear in your child, please.
What are the stages of breast cancer if gone undetected, doctor?
Breast cancer is basically divided into 4 stages. The early stage we call 1 and 2, and 3rd and 3 and 4 is the late stage. I didn't get your second question.
What are the stages of breast cancer if it goes undetected?
Okay, you mean to say if the patient does not realize that she's got breast
Exactly.
cancer? Yeah, it can keep advancing. No, the stages can keep advancing. See, if you're getting treated at a stage 1, there is more than 90% probability for a complete cure. As your stage advances, the probability or the chances of complete cure reduces little by little. And if your the aggressivity, that is the grade of the cancer, also matters a lot. If there is grade 1, grade 2, grade 3, if you're having an advanced stage plus an aggressive grade, then the prognosis is not good.
Can breast cancer spread to different parts of the body?
Yes. Cancer itself, I started off my talk itself to say, cancer itself will start spreading from one part of the body to the other. That is what we call it as metastasis. So cancer breast likes 4 organs to go. It likes lung, liver, bone, and brain. These are the 4 likely areas where this cancer breast likes to spread. Apart from the lymph nodes, axillary lymph nodes, that is the first site where it goes. From the breast, 80% of the lymphatic drainage goes to the axilla, or 20% goes to the intramammary and to the supraclavicular.
Hello, doctor. I'm a 55-year-old male from Chennai. My mother is suffering from breast cancer and her treatment is going on, and she has been operated on the right breast and it has been removed, and she's undergoing 8 cycles of chemotherapy as of now. Is it possible that there can be a recurrence, or she getting breast cancer in the other breast?
Always there is a risk on the opposite breast. So it is not completely ruled out that you can't have a opposite breast cancer, but from the type you're telling you have already received 8 cycles of chemotherapy, which is a systemic treatment, will protect the body on the whole. I will need more information to talk, like on the prognosis. You're basically asking about the prognosis and whether the recurrence can happen. So I will need more information, like the stage of disease and what was the grade of disease, what was the receptor status, and what has happened till now, the type of drugs which has been used, to talk more on the prognosis. Whether there can be a recurrence, whether there's a possibility, or if there is a possibility, what is the probable chances?
Hello, doctor. I have 2 lumps in my left breast, and it's positioned at 5 o'clock and 4 o'clock. I'm sorry, she says that. 5 o'clock and 4 o'clock. Its measurement is 1.9 into 0.7 into 0.7, and the other is at 2.0 into 1.9 into 0.2. And the breast USG says there's multiple breast SOL, likely to be fibroadenoma. My question is, do I have breast cancer? What should I do about it?
No, relax. Fibroadenoma are not breast cancer. You didn't tell me your age. How old are you?
Age is not mentioned,
okay.
Doctor.
So fibroadenomas are benign tumors which won't convert itself into cancer. So relax. These are nothing to be worried. Only if it becomes painful or bigger in size, which needs to be removed. Otherwise, it doesn't need even removal. You'll have to only have a watchful screening. Be in touch with your doctor. As per the intervals where you have to be screened, you have to be screened. But this is not cancer.
What is chemotherapy, doctor? Can you shed a little bit light on that?
Okay. A chemotherapy is a type of treatment which is used for the breast cancer. Basically, for a breast cancer, it is always a multimodality treatment. Usually, three oncology group come together to treat a breast cancer patient. One is surgery, one is medical oncology, one is the radiation oncology. The medical oncologies use drugs to treat the cancer. So that is called as the chemotherapy. There, where you have different types of drugs to treat the breast cancer.
Hello, ma'am. I have pain in my left breast and it hurts whenever I touch even slightly. Is that a problem?
You are telling about a mastalgia. That is the terminology we use in medical field. Mastalgia is pain in the breast. Is it related to your periods? We have to check it. Just before the periods, there is breast engorgement, which will give rise to a tenderness in the breast. Even getting down the staircase, even jumping, or a little bit of jogging, all that can cause a pain in the breast. Sometimes the tenderness is so high, even a slight touch on your breast can give you pain. So this is actually not a direct sign or symptom of a breast cancer. We'll have to examine you. We have to check out more on the history, how long you've been having, and based on that only we can arrive at a diagnosis why you are suffering of this mastalgia. Mastalgia per se is not something to be so scared about.
How can one prevent breast cancer, doctor? This is a question that's asked by many of our women patients, and would you like to respond to that?
Yes. How to prevent? There is no direct prevention, but we can do so many things. Like it has been proven, 30% of breast cancer will reduce if you regularly exercise. Exercise reduces 30% of the breast cancer, which is very good. And when it comes to your lifestyle and diet, we can do a lot of things in order to prevent from breast cancer. Poor diet. There has been a direct proportion when there is a lady who's eating a poor diet being affected by this breast cancer. Coming to the lifestyle, a sedentary lifestyle, when you don't take enough colored fruits and vegetables in your diet, all that also has a bad influence on breast cancer. So even the fat cells, fat can produce estrogen. Since these breast cancers are hormone dependent, if you are obese, that also becomes a risk factor. So good amount of exercise, a good nourishing diet, a proper diet, and a stress-free lifestyle, which I want to stress upon. Apart from your diet and all that, a stress-free lifestyle is a must. Yes, this world is competitive and we have to win, not at the cost of your health. So be relaxed, have enough activities apart from your work, so which makes you happier, and a stress-free lifestyle will definitely help.
Hello, doctor. My mom, 56, has hormone-sensitive breast cancer and she's on letrozole for 4 months. She suddenly has fever and chills occasionally, and it's been almost 2 weeks now. The lab results came okay. What is causing this fever? Can you please tell us?
The fever and chills, we need to investigate whether it is drug related or anything else. This has to be investigated at the hospital level. I won't be able to tell in an open forum, like whether it is this only or it is drug related or not related. You'll have to meet your oncologist. We'll have to check it out, because frequent fever and chills may not be related to the drug.
What is lumpectomy, doctor?
Just removal of a lump. If you see a lump, a mass in your breast, just removal of that portion of the lump is called as lumpectomy. Ectomy means removal. Lump removal from the breast is called as lumpectomy of the breast.
And can pregnant women also suffer from breast cancer?
Yes, it can. It is very complicated whenever we see breast cancers in a pregnant woman, especially in the first trimester. We won't be able to do anything. We can't do surgery, we can't do chemotherapy. And if it is an aggressive cancer, we even advise the patient to go for an abortion and then treat her. And if possible, if it is safe to continue the pregnancy, then we can interfere with the treatment in the second and third trimester. It's very difficult, and we do see cancer breast with pregnancy also.
Hello, doctor. I'm 31-year-old female from Madurai. My grandmother had throat cancer. My mother, aged 54, is suffering from breast cancer now. Is this hereditary? I'm 31. Should I go in for mammography? Many of them said that I too will will or may suffer from cancer in future. I'm scared. Is this true?
It is not two breast cancer, subsequent breast cancer. One grandmother had a throat cancer. The mother has had a breast cancer. It is unfortunate, like every generation is having a cancer, but that doesn't have to panic you. Say, like, all of us are born with an oncogene. Sometimes it is little prominent in certain people. First, you have to remove the fear. Have you started on the self breast examination? Have you consulted your oncologist on this? Don't panic. Just 10% is the risk. I repeatedly keep telling it is only 10% risk. You have to be aware, but no fear. You have to be aware, but you should not have fear. I don't want stress. Unnecessary stress is not going to cause a remedy for your fear. So please consult your oncologist. Probably you'll have to be on a regular screening program. Mammogram is not indicated for you unless and until it is warranted with some lump or there is some suspicion in your ultrasound. Even then, there are mammograms are available, that is MRI mammograms are available, where there is no radiation exposure at all. Just relax, go to your oncologist, and you will get guided properly.
We've had a couple of other questions also on the same lines, doctor. Can you tell us a little bit about the myths related to breast cancer today?
Okay, the myths. Okay, there are a lot of myths. One of the myths is, if you do biopsy, the cancer will spread. No, it is wrong. Small breasted women will not get breast cancer. That again is wrong. Males do not get breast cancer. It is a rare condition, but males also do get breast cancer. Then there is this hormone BRCA1 and BR. If it is positive, then you are 100% that you will get breast cancer. No, there is a high probability. It is not a confirmatory test. And I'd been recently to a college, and there was a young looking and pretty girl who asked me whether using a black brazier can cause breast cancer. No, it is not. Again, it is a myth. Probably this question must have arisen because black attracts radiation, that is the sun rays. Probably that is why that kind of a myth. No, it doesn't. And what are the other myths? If you can name, I will be able to tell. To my knowledge, these are the myths.
Can you tell us a little bit more about the treatment of breast cancer at Apollo Cancer Center, Teynampet, Chennai?
Oh, our hospital is a full-fledged Apollo Cancer Hospital. It's a full-fledged as having full oncology treatment. And the three main specialties, surgery, radiation oncology, medical oncology is full-fledged. All the supporting departments like pathology with the frozen section we have. And we have a wonderful radiology department. Diagnosis is very, very good. We have the PET CT, we have 2 in number. And the diagnostics tool like with a mammogram, MR mammogram, TOMO, you name it, everything under the same roof. Apart from that, we have other specialties to support the anesthesia. We have cardiology, we have pulmonology, we have everything under the same roof. And coming to my radiation oncology, I belong to the radiation oncology group. My department is a beautiful department with 4 bunkers. We have 3 linear accelerator and 1 cyberknife radiosurgery technology. We have a HDR brachytherapy, and it's a full-fledged department.
Hello,
to name just one about the surgery, we have sentinel lymph node biopsy, frozen section. So nowadays it is not like you go for a high mutilating surgery. Wherever possible, breast conservation is done, thereby saving the women's breast, which makes a lot of psychological difference.
Thank you, doctor. Hello, doctor. I'm a 21-year-old from Chennai, and there is a crack in my nipple. And apart from this, I have no other symptoms. Is it a sign of breast cancer?
Just a crack in the nipple alone is not a sign of breast cancer. We'll have to see for the duration, how long you've been having this crack in the nipple. Is there any discharge from the nipple? And whether you have any allergy, even like your brazier can cause an allergy, and that would have caused this crack. Whether it is associated with itching, and what treatment have you done till now? And is the crack persisting? If there is it's a simple crack, it has to heal.
Hello, doctor. My mother, aged 64, is suffering from breast cancer stage 4. I need to know what is the most effective treatment for her at the present. I would like to save her.
It's unfortunate the disease was detected at stage 4. But even if it's stage 4, nowadays we have lots of treatment options. You are not told in what specification she has become stage 4, whether it was a single brain metastasis or a simple 1 or 2 skeletal metastasis or liver, or I don't know. It is just all these are stage 4 diseases. Even with oligometastasis, even with 3 brain mets, we have cyberknife radiosurgery where we treat and we attempt cure for all these patients. So you don't have to give up, and you please come and approach us. We will see what stage of disease and where all the cancer is affected and what best we can do.
Hello, doctor. I'm 52-year-old female from Chennai. I have undergone surgery for breast cancer, and my custom panel report states invasive carcinoma breast, tubular lobular variant, luminal B, like 2 negative. What treatment should I undergo?
You have not mentioned about the size of the tumor.
No.
We need to do more staging workup. This is a histopathology report telling what is the type of cancer you're suffering from. And next step will be the staging workup, hormone receptor status. Based on all this, your treatment will be designed. It is not one same thing for every patient. Every patient is an individual, and every small bits of information is very, very important to design your treatment.
What are the potential side effects of a breast cancer surgery, doctor?
Lymphedema. This is the most commonest problem, which when you do the full axillary dissection, when it is spread to the axillary lymph nodes, and when you do the lymph nodal dissection, this is commonly seen. Lymphedema is swelling of your arm on the affected side. So this is one of the commonest symptom because of the surgery. It can happen, and this is preventable. We help you how to prevent and what are the what we can do to prevent this lymphedema. That is what I was talking about, the surgery, the sentinel lymph node surgery, where we do only selective lymph nodal dissection, and we have a very beautiful surgical department here who does wonderful surgery. And as I used to see lymphedema in the past, I'm not seeing that more and more nowadays. It's reduced a lot.
An 18-year-old girl has wanted to be anonymous. I have some red dots on my breast, and I'm just 18-year-old, and I'm scared whether it could be a sign of cancer.
Red dots could be even pimples. See, pimples not only come on the face, it comes on the anterior part of your chest also. Probably it's just an acne which you are worried about. Just consult your dermatologist, and that's it. You don't have to panic about all this.
What is the difference between invasive and non-invasive cancer, doctor?
It's at the level of the microscope what we see, invasive or not invasive. Invasive is when it invades the basement membrane, goes down, and that is it's a serious form of cancer. Non-invasive like DCIS or LCIS, where it is not invading the basement membrane, or in other terminology, it is a precancerous condition. So that's the difference between non-invasive and an invasive cancer. In situ cancers are non-invasive.
Which is the most aggressive form of breast cancer?
Aggressivity is depending on the grade. Higher the grade, it is an aggressive cancer. Initial part of our talk, you asked me what is inflammatory breast cancer. That is an aggressive form of cancer. Metastasized, when it has already gone to different parts of the body and with the poorly differentiated features, these are aggressive form of cancers.
What would be your message to our viewers today, doctor?
Message. I would say the lifestyle should be taken care a little bit more. Let us have a stress-free lifestyle. Apart from that, one has to be aware of one's own organ. That is the take-home message, I would say. Please do practice self-breast examination. All the people who are going through the regular periods should do after their periods, and the people who have already attained menopause should fix up a day every month and be please aware of your breast. So if there is a small change in the breast, if there is a discharge or there is a scaling of the nipple or a dimpling or a dripping or redness or a lump in the axilla, in the breast, you will become immediately aware of it, and you can fetch help. If you fetch help, it will be much earlier. One more thing I would like to say, 80% of these breast lumps are non-cancerous. Only 20% will be cancerous. So if you are aware of your breast, if there is a small change, you can approach for help and completely be saved out of this disease.
Thank you very much for an informative session, Doctor.
Thank you.
For appointments with Dr. Rathna Devi, oncologist at Apollo Cancer Center, Teynampet, Chennai, please contact 9677151127. I repeat, +91 9677151127. Thank you very much, Doctor. Thank you, viewers.